Every single time you swallow a pill, you're kicking off this incredible hidden journey inside your body. It's a journey that literally determines whether that medicine is going to work at all. Today, we're going to pull back the curtain and understand the secrets of drug dissolution.
I mean, really think about it for a second. You take this tiny, solid object, how in the world does it know where to go? How does it start to make you feel better? The magic isn't just in the chemical itself. It's all about how it disappears.
All right, so this whole process, this entire journey, it all hinges on one absolutely critical concept: dissolution. So let's break down exactly what that word means.
On a basic level, dissolution is something you see every single day. Just picture stirring a spoonful of sugar into your morning coffee. You see the solid crystals, you stir, and poof, they vanish. They spread out perfectly into the liquid. That's it. That's dissolution in a nutshell, a solid becoming part of a solution.
Okay, so now let's put on our pharmacy hats. In our world, dissolution is specifically about that active drug ingredient breaking free from the solid pill it's trapped in and dissolving into the fluids of your stomach and intestines. You can think of it as the great escape. It's the step that absolutely has to happen for any medicine to even begin its work.
So, let's actually follow that pill's journey, right from the moment you swallow it. It's really a three-stage race to get that medicine from a solid lump into your system where it can do its job.
Okay, step 1, disintegration. The pill doesn't stay whole, it has to crumble and break apart into much smaller pieces. Then comes our star player, step 2, dissolution. This is where those tiny particles actually dissolve into the liquid around them. And only then can the final step happen, absorption. That's when the dissolved drug molecules can finally pass through the intestinal wall and hitch a ride in your bloodstream.
And here it is, maybe the most important point of this whole thing. A drug has to be dissolved. It must be in that liquid molecular state to get through the body's membranes. A solid particle, no matter how tiny, just can't squeeze through. It's a hard and fast rule. No dissolution means no absorption, which means that medicine you took has zero effect. It's a total non-starter.
Now, what's so fascinating about this three-step process is that the steps don't all happen at the same speed. Not at all. It's just like a factory assembly line, right? There's always one station that's a little bit slower than the others, and that one slow station controls the speed of the entire operation.
In science, we call this the rate-limiting step. It's the bottleneck. It's the traffic jam on the freeway. It doesn't matter how fast all the other cars are going. The entire flow of traffic can only move as fast as that one slow spot. For delivering a drug effectively, figuring out this step is everything.
So what is the rate-limiting step for our pill? Well, it usually depends on the drug's personality, specifically how well it dissolves in water. For drugs that are poorly soluble, the ones that kind of struggle to dissolve, then dissolution itself is the big bottleneck. But for drugs that are super soluble, the ones that dissolve almost instantly, the bottleneck actually shifts to the next step, absorption, the challenge of physically getting across the gut wall.
And this is where pharmaceutical science gets really, really clever. Because scientists know that dissolution is so often the bottleneck, they've figured out how to control it. Think of it like they have a whole dashboard of levers they can pull to speed it up or slow it way down, depending entirely on what that medicine needs to do.
These levers, they pretty much fall into three main categories. First, you've got the drug's own inherent properties. It's physics and chemistry. Second, there's the formulation, what I like to call the pill's recipe, all the other stuff mixed in. And third, you have the environmental factors, like the conditions inside your own body.
First up, particle size. Let's go back to that sugar analogy. A solid sugar cube in your tea dissolves pretty slowly, right? But granulated sugar, it's gone in seconds. Why? Because all those tiny little grains have a much, much larger total surface area for the liquid to attack. It's the exact same for drugs. Smaller particles equal more surface area, which means way faster dissolution.
Another really cool property is the drug's internal structure. A drug can be in a highly ordered, stable crystalline form. Think of a diamond. It's very stable and tough to break down. Or it can be in a jumbled, disordered, amorphous form. This amorphous form is less stable, it's got more energy, and it's way more eager to dissolve. Scientists can actually choose which form to use to get the exact dissolution speed they're looking for. Okay, next up, the recipe. A pill is never just 100% pure drug. It's always mixed with these other inactive ingredients called excipients. And these guys matter a lot. Some of them act like helpers, helping the drug dissolve faster, but others, especially ones that are hydrophobic, meaning they hate water, like magnesium stearate, can actually coat the drug particles and hit the brakes on dissolution. It's a really delicate balancing act.
So how on earth do they test all this stuff? Well, they use this incredible machine called a dissolution apparatus. It's basically a stand-in for the human gut. You've got these beakers of fluid kept at perfect body temperature with paddles that stir and churn just like your stomach. This lets them precisely measure how things like temperature and agitation affect how fast that pill dissolves.
Now, if we zoom way into the microscopic level, scientists explain this with something called the diffusion layer model. The theory is that a super thin, unstirred layer of liquid forms right around the surface of a drug particle. So the drug first has to dissolve into this tiny stagnant layer, and then it has to diffuse across it to get to the main party in your stomach. The more your stomach churns, the thinner that layer gets, and the faster the drug can get out and dissolve.
All right, so let's put all of these pieces of the puzzle together. The big takeaway here is that by understanding and, more importantly, manipulating all these different factors, particle size, crystal form, the recipe, scientists can literally become architects of drug delivery. This is exactly why medicine isn't a one-size-fits-all game. If you have a splitting headache and need relief now, scientists will design a pill with tiny, amorphous particles that dissolves in just a few minutes. But if you have a chronic condition and need a steady dose of medicine over a full 24 hours, they'll design a pill that dissolves incredibly slowly. It is all about controlling the rate of dissolution.
And this brings us to a really powerful, almost counterintuitive idea. For those amazing once-a-day pills, scientists don't try to make dissolution fast at all. They do the exact opposite. They intentionally design the pills so that dissolution is super slow and becomes the rate-limiting step on purpose. They take control of the bottleneck to give you that perfect, steady release of medicine all day long. So next time you take a pill, just think about that incredible science and engineering packed into that tiny little object. Now that you know the rules of the game, how would you design it? Would you grind the particles down to get a super fast effect? Or maybe use a more stable crystal to make it last all day? The power to heal really does start with the simple, elegant act of dissolving. Thanks for joining me.